Lesufi, I'm very happy to see you this morning.
Thank you so much.
Let's talk about your idea and why go this route. What is the purpose to sort of weed out those who should not be attending or those who might be troublemakers in school? Or is it for their own good? What do you propose to do with this testing?
You must accept that the current programs that we have to fight drugs in our schools are not yielding the desired outcome. We're having cases of drug-related matters almost every day. The pain that I have to go through to sign expulsion letters of learners almost daily that are found with drugs or addicted with drugs or are taking other learners, it's too much. We need to find a way of intervening. The current legislation says you test learners when you suspect there is a problem, which simply means it becomes reactive. We are suggesting that instead of having those random testing, let's do it in a humane and caring manner at the beginning of each quarter, so that we've got a learner profile and our intervention programs can then deal with each learner according to the profile that we have.
So this is every high school pupil throughout their high school time in high school every quarter?
Yes,
is that what you're proposing?
We've worked with NGOs, we've worked with other government departments to assist us to find a mechanism of dealing with this thing. So we really believe it's a debate that we want to deposit in the public platform. We are not saying we're going to do it immediately. We're saying let's discuss it because the current programs that we're having are not yielding the results. The number of young people that we are losing out of this problem of drugs, rehabilitation centers are full, so we can't even take them to rehabs. Some of the activities they're doing are too violent. I mean, I was at the school last week. In my presence, 2 teachers were attacked. And those learners, when we tested them, we found that they're using drugs. So we are just calling for parents, NGOs, government departments to say, here's a debate. We really believe it can assist us to identify the problem earlier rather than wait for some wrong things to happen before we can intervene.
So you do the testing, you find that a pupil is on drugs. What do? Do you kick them out of school? Do
Surely
you
not.
Assist in their rehabilitation?
That's it.
How far do you take it in terms of also how involved do you get, whether there's a problem at home, what's the social issue here? How much will it be your problem to solve?
No. 80% of the problem will be ours to solve. Truly, because learners spend more time with us than with their parents. So if we've identified that the learner needs assistance, we then can pull all the NGOs or government departments that can come and assist us. Remember, we've got an integrated program as the social cluster of government with the Department of Health, Department of Social Development, Department of Sport, and other departments. So we can find a mechanism of dealing with the problem. But if we don't know, the problem is that we are having a one-glove-fits-all solution where we think all learners are the same, and we all know they are not the same. There are those that need assistance, there are those that don't need assistance. So put resources to those that need assistance. We really believe we can nip it in the bud.
Now, I'm sure you're aware that the problem goes down even to primary school. There are many primary school pupils. This is probably, a big problem at the moment as well. So any plans for this to extend into primary school, or what is your thinking there?
That is why our approach is integrated. We are not say testing alone. We say our life orientation program should continue to galvanize learners to be aware of the kind of drugs and the effect of those drugs. We also want to have the advocacy campaigns of having posters in the school and other things. We also have a voluntary program where learners on their own can come to us. We can be in a position to assist them. But I share your sentiments with the primary education. It's not only about that. It's a teenage pregnancy as well. It's hitting our primary school as well. So we need to find an integrated approach to confront the problem. But to fold our arms and say, let the status quo remain, I can assure you, it's not assisting us. The numbers are huge. The numbers are disturbing. We need to intervene and intervene now, or else our young people will miss opportunities that this democracy is creating for them.
So no testing in primary school, no plans for that?
For now, it's not there. We are saying let's deal with it at the high school level because we believe we can have the necessary consent in terms of age, in terms of parents, and also in terms of the rehab programs that the NGOs run, because some of the NGOs programs are camp-based, so it will assist us to ensure that we manage the process.
Okay, you said earlier, MEC, that the drug rehab centers are full, they don't even know where to put people. So what do you do with those people? If you want to help in their rehabilitation, where are you going to take them?
That's the thing. You know, the mere fact that we're in a position to identify, have a profile, it will assist us in both planning in terms of resources and infrastructure. But now you can't, because you don't know who's affected or not. But when you start to do the testing, you are budgeting, you are planning, you are infrastructure development, you are interaction with other NGOs will be informed by data rather than a thumbsuck approach where you don't know who will rock up at your door tomorrow.
Now, you say Section 8A of the Schools Act allows you to conduct these random searches and drug testing, so you don't need parents' consent for that. There are organizations like the Anti-Drug Alliance, SA, they say that it's an invasion of privacy and human rights.
That is why we want it voluntarily. That is why we are not forcing anyone, not say it's compulsory. We are making the facilities available. If parents believe that children can interact, we will. We have to do it humanely. We have to do it in a caring way. We have to counsel learners before you even do it, so that learners understand the consequences.
So what will be the point then if it's voluntary? Because do you honestly expect then that those who are on drugs will come forward and say, test me?
Check the number of HIV/AIDS tests that have been done in our schools now. It's voluntarily, and we have the statistics, and people give us those statistics. It's very important that we make it voluntarily, because the day you make it compulsory, then you are making it resisted. People will resist it, and if they resist it, you lose the purpose. Make it available. Parents can bring their children on board. Everyone can bring their children on board, and you can be in a position to assist.
So you're relying then on parents of those who might be on drugs and those who are acting out, say, but don't come forward. You're relying on parents to be the volunteers.
It's very important that parents are there and they give us the support that we need. It's very important communities are there and they give us the support that we need. All of us, collectively, we have to confront the scourge of drugs. It's a bad thing, good people. If we can't do that, I can assure you, we'll surrender our children to people that don't have their interest at heart. And if we start to surrender our children to people that don't have their interest at heart, we have lost a big chunk of opportunities for our young people.
When do you plan to go full force to this? We know some schools already conduct random searches, they check bags, they do. When are you planning to do this the way you're planning to do it?
Well, we've deposited in the public platform, we've deposited at the policy conference of the ruling party. We are going to the national conference of the ruling party during the month of December. We hope we'll persuade conference delegates also to debate the matter and find a solution. If they do, then the relevant departments will take over and start to do the legislation that will allow us to enforce this important decision.
Will that include consultation with parents?
Definitely.
At every single school?
Definitely.
And you're confident that such a program will get drugs out of schools?
If there's any other program outside this one, we are also willing to look at it and debate it and discuss it. We are not saying what we have put now is the only solution. We are saying let's debate and discuss. Maybe other people have better ideas. Let those ideas be incorporated as well. It's very important that we collectively confront the problem. We just can't fold our arms and say we are defeated. If we do that, don't count me in.
Okay, and if you are depending on NGOs and you're depending on social development, for example, maybe to get involved in the state of those departments, I mean, they can barely handle the work that they have at the moment. Are you sure they're going to be able to help you with the rehabilitation?
No, they can. I mean, I know from the provincial point of view, we work together with all government departments. So we've identified drugs as a problem, not only for purpose of assisting learners, but also the law enforcement agency stepping in and attending to the problem. So let's just bring everyone that has the legal mandate to deal with it, to attend to the problem. We can't just say currently we are facing challenges, therefore let's abandon the ship. Let's continue to work hard, and I think we'll yield the necessary dividends.
All right, thanks very much for that. That's Gauteng Education MEC Panyaza Lesufi.